Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Here we are.
Have you got your flu shot yet, Dr. Mencia?
Oh, from the very beginning.
Yes,
yeah,
me too.
I like to get it before the snowbirds get here.
And I only get it at the medical center. Of course, you're my medical center, but anybody else, please don't get this at, don't want Walgreens or CVS to be mad at me, but I really think you should go to your doctor.
To your doctor, because it's your record. You know, you want to keep your record straight, especially when it comes to your immunization. And if you get it on multiple sites, then you don't know, for example, the pneumonia shot. Did I get it? When did I get it? I don't know. I don't remember. It was at the pharmacy. Which pharmacy? I don't know.
Yeah.
You know,
well, I know that sounds crazy. I'd rather have it under the auspices of a physician, too. Isn't that funny?
Yeah, sometimes even some of the big corporations, they want to give it to offer to the employee there so that they don't have to go outside, take time off to see the doctor. But why not? I mean, it's not just a flu shot. It's getting your blood pressure checked, see how your weight is, have you gained weight, you know. So all of those things, look at your blood test, discuss your blood test with you. Because one thing is to get a blood drawn and say, everything look good on you. But that's not preventive medicine. Preventive medicine is when we look, for example, at your cholesterol profile. How is your good cholesterol, your HDL? I have one patient that I saw that her previous primary care doctor thought, jump on her because her bad cholesterol was 5 points above. She says, only 5 points. And he jumped on me. I have no cardiac history. And I've been a good patient. I take, I follow a great diet. I take supplements. And he's telling me 5 points. So I decided to come and see you because she listened to us on the radio. So she said, I decided to come and see you. And she came to see me, and she said, I want someone that can do integrated medicine to see what you think. I said, well, let me tell you, I have not drawn blood on you. I'm just looking at the blood test from your previous doctor. This is one of the best blood tests I have seen. I have a handful of patients that have a blood test like this. They say, what about the cholesterol? I said, listen. Your HDL, your good cholesterol, is 110, for God's sake. That's so high, you don't see that. I want to know what you are eating. I want to know what supplement you are taking, because whatever you're doing is great. And her supplement is not the same like what I have in the office. And I say, don't buy what I have. Keep taking what you are taking, because, a handful of patients, some of the patients that buy the supplement from us over there, a few of them, but they are very diligent taking the supplement. When it comes to supplements, a lot of time people are like, hey, it's a supplement. Well, big deal if I don't take it. It's not like taking a prescription medicine that I say, I have to take my blood pressure. I have to take my diabetic medication. But when you take a supplement can do so much for your sugar and help you and bring your good cholesterol to such a high level that we don't even worry about the bad cholesterol, because your heart and your brain are so well protected by the HDL cholesterol. And that's what people don't see when, you just go to, let's say, to a big corporation to draw your blood and give you your immunization. You need to discuss with a doctor that is into either integrated medicine or preventive medicine, somebody that is very in tune with preventive medicine. Because it's not about treating the anemia, but looking at some of those parameters that you get on your blood count, on your CBC. Some of the parameters start going abnormal before you become anemic. If you have kidney problems, some of the hormones that get processed by the kidney to stimulate the bone to produce red blood cells get affected with kidney disease. So in preventive medicine, we say, well, there's already some kidney damage, So we have to now prevent the kidney from getting worse, but we also have to prevent the bone from not getting the right nutrients so that the bone can continue to produce red blood cells and you don't become what we call anemia secondary to chronic kidney disease, which is a true diagnosis, that has a ICD code and everything. So it's a diagnosis out there. In preventive medicine, we want to avoid those things. If you have emphysema, if you have memory decline, if you have depression, if you have MS, all of these conditions that affect certain organs, in preventive medicine, we want what other organ can be affected by this condition so we can prevent that. For example, a person that has MS, vitamin D is so important to them. But if you look at the parameter that reads out there, they say if you are above 30, you are normal. You are, that's good enough but for what? For bone protection, not for the brain. For the brain, it have to be around 60, double that number. But the parameter will never tell you that. But the research has been out there showing that vitamin D is so important. And for those people that, for example, have that condition of MS, multiple sclerosis, if you have younger daughter, kids, the daughters need to have their vitamin D checked, even if they are teenagers, because they need to take vitamin D to keep the level off. And this is now preventive of MS on the offspring. So that's what, there's so many things that go through our head when we are treating one patient, one individual.
But actually, I think that you are really very aware of supplements, more so than most doctors, because I've always felt supplements were important, and yet for years doctors said, no, it doesn't matter. But you are very, very strong on taking supplements based on the blood results.
Absolutely. Yes, absolutely. And supplements, can be important for beautification, your nails, your hair, your skin, the collagen producing supplements. So supplement can be important only for your health, for you to, live long, but for you also to look good. The sun blocker, for example, when we do integrated medicine, we want the sun blocker that will protect you from skin cancer. We just had a patient that relocated here from South Africa, and was diagnosed with skin cancer on the first visit. But the good news, it was localized in the face. So right away we sent it to the plastic surgeon that we work with to have that removed.
And what actually was it? Like a
melanoma. It was very aggressive. Melanoma is one of the most aggressive skin cancer there is. So
how did he remove it? He cut it
you
out?
Cut you have to cut the white section. That's why the plastic surgeon, not the dermatologist in my office, because you have to cut a very wide section and deep to make sure you grab everything. And,
And then what, do they take skin from somewhere else to replace that, or what do they do?
Well, no, the suture, because it's a plastic surgeon, the suture are done with so neatly with, the right amount of thread underneath. So it's a couple of layers of thread so that the skin, when it closes, you can hardly see the scar.
I see. Well,
Yeah.
so then you refer the plastic surgeon, then you watch over the patient.
Right.
But so you caught that when the person came there.
The first visit. Visit. And it was a small lesion, but they have all the characteristic of skin cancer that we have dedicated program to skin cancer prevention. We saw the little feet at the border, the size, and the guy saying, it's just look bigger than it was 2 months ago. I said, ooh, that's a bad sign right there, I tell myself. And say, okay, let's take a little sample. And the dermatologist was there, took a sample, sent it out, melanoma. Let's get this person at the plastic surgeon right away. And that's what prevention is all about. It's been on top of it. And a lot of the patient going back to the medical side, a lot of the patients that come there, they always compliment us for the speed of service, that we don't drag our feet. We take care, and we are a team. So it's not like we neglect the patient. We take care of the patient, but there's a lot of behind the curtain. A lot of action go behind the curtain. So when you are coming, we try to have all the labs ready to go. What is going to review that day? If we're going to draw blood, we have the kit set aside for you so that we know that we're drawing blood, so that we can get you in, get your prescription, get your blood test, send you out. When you come back, then we review the blood test with you, see if you need any other prescription. But we spend time there doing the review, going through the blood test. Sometimes they want a copy of the blood test. They can put their email into the medical record, and they can go and pull out information from their chart. Where before you used to go, you can go, you put your email in, they'll send you a password, and with that password you can go ahead and access your medical record and say, okay, let me see how my blood tests look. Let me compare to the last one. So by the time you come to the visit, you come with legit questions. How come this number here was here and now it's there? And we look, and then we can explain to the patient if that is a bad thing or is it a good thing that that's happening,
That's terrific.
My A1C was 11. How come now it's 6? It's dropping. Do I need to get transfusion? I say, no, that's good. I mean, your sugar is very well controlled now.
One thing I was thinking about is I have from time to time heard people say that they needed a neurologist, they needed this, and there was a 6-week wait or the 3-week wait.
Exactly.
And I've been so upset, and I know that's something that you don't do, no matter how busy or tired you are, how full your schedule is. If someone really has an urgent situation, you figure out how to get them in. And I have to just give everybody your phone number, because I just have to tell you, if you're not going to the AGI medical and dental centers for your care, whether it's for your physical or your dental care, you're crazy. Sorry. I just have to say that you're crazy. I mean, I just wouldn't know what to do if I didn't have Dr. Mencia around. So phone number to call, make an appointment, is 954-489-1345. That's 954-489-1345. And Dr. Mencia is...
for Lauderdale one.
Oh, yeah, that's right. And then the one in Palm Beach County is 561-270-6494. And that's over there in Palm Beach County, which is Hagen Ranch Road. It's a little bit right off Jog Road.
And now in Stonewater, 954-561-8799.
Now we've gotten the whole person, right?
Yeah.
The whole person. Now you're going to be able to go to Stonewater. If you just tuned in, last 30 minutes, last half hour, we talked about the new spa, Stonewater Spa, but it's now going to be called Med Spa. Exactly.
Yes.
The address is 2767 East Oakland Park Boulevard. They are open. They've been open for many years.
26 and a half years.
But now it's going to be under the protection and the watchful eye of Dr. Mencia, and it's wonderful. So there is a website. You can go there and get an idea of what it looks like. It's Stonewater, Florida, at stonewaterfl.com. Mm-hmm. But it is really a thrilling thing to have all of this. So,
well, it's Stonewater FLA.
Yeah,
FLA.com.
FLA? Oh, FLA, yes, it's right. And the services, you do so many things. I think when you look at this, you're really going to do a lot of things for people. So when people come to your medical center, your dental center, are you going to just send them over to Stonewater and say, okay, that's your last thing you have to do?
Well, Stonewater had been there for 26 and a half years. I've been going there for the past 20 years since I moved here. My kids grew up going there. And when my kids moved to the Ray, they would come drive over because they knew the staff already. And the last thing that I thought, God would put in my hand, such a facility that we have gone for service for so many years. So when a corporation like this, a company, has such a solid reputation, now we have to think what we're going to do to exceed expectation on the customers. Sometimes, it's all the people that take care of you. And as you know how I run my business, I'm very much on top of things. I'm not an absentee manager. I'm on service.
We call it live, breathe, sleep it.
Right.
That's what you do.
That's right. And I remember when they gave me medical directorship, like for nursing home or something like that. And they would say, well, we just need a medical director. And I say, no, honey. If you're going to pay me to be a medical director, I'm going to be hands-on. So if you want me, we're going to interact. And they just want sometimes just a name to sign the paper and walk away. And I say, no, I don't do that. So when I got into now with Stormwater, that had been now it's our first week since we took over the ownership and management. We want to make sure that we're going to exceed expectations. So we already started working on setting a faster telephone line and credit card machine. We have an ATM that people can go and pull out when they want to give tip. If they want to give a cash, we have an ATM.
The ATM machine.
We have an ATM machine is in there. So we have a hair section, a nail section, the medical section where we do the Botox and the filler and the laser and the different services. And then we have the massage and facial area all separate. The dressing room has, keys so that you have privacy to put your personal belonging and you keep your own keys. And the relaxation area. There's a relaxation area where you can sit down while you are waiting for your treatment or after your treatment if you want to sit down and have a cup of tea or, eat some grapes.
Eat some grapes. Well, I was just looking at this brochure, and the massage therapies, it's not just massage. It's you get a choice of a Swedish, aromatherapy, a deep tissue, a reflexology, healing stone, Swedish Thai. Oh, you have something called a sugar scrub. That way, Bill can come and lick off all the sugar off me, right? He loves sugar. You have a detox seaweed body treatment. You have a hydrating after sun soother. Let's see. You can have your hair all different colors, and extensions. That's and very popular now.
The ionic detox foot bath.
I had that done. I've had that done.
I never had it done.
You should go get that done. Yeah. It is amazing, Dr. Mencia, when you put your foot into this,
ionic water.
Yeah, ionic detox foot bath. The stuff that comes out, it becomes dirty and I guess it's
color,
pulling out. Yeah, it's pulling out chemicals can act as toxins that can block receptor sites and cells. Been around for a long time, and I've done this.
Yeah, for the skeptical there,
metals and chemical toxins.
Remember that Chinese medicine depend very much on the sole of the feet, and they can map the entire body in the sole of your feet.
Oh, I don't know that.
So yeah, the liver, the heart, the lungs, they can basically map all of this in the sole of your feet. So when you do reflexology, acupressure, the Thailand acupressure is very good at that. And they go to different area. And, when they examine you, they look at your tongue, they look at your pulses and your hands and what have you. And when they do an examination, they say, we need to work with your thyroid. And they go to this area on the feet. And if you were tired, you get out of there like so rejuvenated. Now, mind you that Asian medicine has thousands of years of experience. So as a MD, I integrate, I embrace the Asian philosophy and the Asian knowledge and the experience into the medical, because the medical is very recent, very young. Was a lot of things that we use that we really don't know. A lot of the antibiotics and things we say, this medicine is good to lower your blood pressure, but then you say, how does it work? Because that's what science is all about. We want to know everything. And the usual line is the exact mechanism of action is unknown. But we suspect, according to the research, that it's doing this, that it's doing that. So we are speculating. It's a lot in medicine that we really don't know yet. And the Asian medicine for thousands of years, they have no worry about what is the exact mechanism of action, how acupressure or reflexology, how does it work? We know there are some meridians that have been identified for thousands of years in the body. And Asian medicine, they work on the meridians. So when you're doing acupuncture or acupressure, we are working on those meridians. And I tell you from my personal experience, growing up in Hawaii, I was a taekwondo fighter. I was undefeated for 7 consecutive times. And that's where I get all my discipline on my business, from taekwondo. And I remember many times I would be fighting and I would get hurt that I have to either bow out, and my coach, who was Korean, would grab me and would do acupressure on one part of my body. And he hold there for 15, 30 seconds, and then he would release, and he would say, okay, go back and fight. And I would get up there like nothing happened to me. So, I got to experience how acupressure and acupuncture works. And if you were getting a migraine, I remember my coach would come in and he taught me how to do the exercise for migraine. And there are certain point on the head that you press on, for a few seconds, and then you keep rotating, and you make like a circle around above both eyes, and you keep doing this rotation, and people will get up and say, wow, my migraine is gone. My headache is gone. And so, I seen it in real action, how this works, either on myself or other people around me. I seen how this thing works. So
do we have any?
In the Stonewater med spa, that's what I want to do. I want to integrate all these
Chinese, yes.
Asians with
So do we have anyone there? Do we know yet? Do we have anyone there that does any of that? Let's see. It says, well, I guess they learned that. This says Thai. Here it goes. Deep tissue healing. There's a Thai treatment or something. I forget where I saw that.
Mm-hmm.
But I bet that someone who has that experience.
So the salt bed, look at the salt bed,
I know.
We have said in Hawaii, we always say, if you have a wound or something like that, go in the ocean.
Yes.
And you will heal.
Yes.
And so people go in the ocean. What is in the ocean? Salty water. You have a upper respiratory infection, something like you go in the ocean, right? So when you are inhaling this air from the ocean, it's healing to the body.
But wait a minute. Also, people go to somewhere. I know. Is it in Israel? Somewhere where they have
the Middle East somewhere.
That it's all salt. They go
and
to
people go to bath there.
So
and they can flow there.
So there, you don't have to go there. Here, you're going to be able to go, and this is a beautiful piece. I mean, this is unusual. I don't know if anybody has a salt
There are very
bed.
few salt beds in South Florida.
Right.
We are one of the few centers. I don't know how many centers in reality have the salt bed, but I know when I purchased the spot that Raymond, one of the person that had been there for several years, he was telling me that where he used to work before, they had a salt bed. And there's a few places in South Florida that have a salt bed therapy.
But, it talks about...
And it's great for the skin.
Yeah, it says acne, dermatitis, psoriasis, eczema, healing. I also was told because of my being an asthmatic at certain times, that the breathing is very good to clear your lungs.
Absolutely, yes.
So you recommend that?
Mm-hmm.
We'll have to get you into all these things, right? So we have to...
I got to go and be pampered.
Yeah, be pampered. And you go in. Okay, that's really wonderful. Well, it's called Stonewater Med Spa And the phone number again is 954-561-8799. And Dr. Mencia is so thrilled about this. You can see 2767 East Oakland Park Boulevard in Fort Lauderdale. And we will be seeing you there. We'll be seeing you over at the AGI Medical and Dental Centers. And soon you're going to be the king.
We want to hear your feedback. We want to hear people's feedback because we want to, it's a big responsibility. It's not just a spot. It's a spot with 26 and a half years of existence.
Yes.
So we have to raise the the bar and bring customer satisfaction to a different level.
With everything. Well, thank you, Dr. Mencia. And we will be back next week with you in all your brilliance.
Yay!
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.